Painful periods are incredibly common in women. Painful periods are medically called as dysmenorrhea. Hi friends, this is Dr. Rajeshwari Reddy. I'm an obstetrician, gynecologist and a laparoscopic surgeon from Hyderabad. So today we will be talking about painful periods. About 80% of women have varying degrees of pain during menses, but only 10% of these women have debilitating pain, which means unbearable pain or pain which is not relieved with medication. So let's see what is normal periods. Normal menstrual cycle is 28 days cycle plus or minus 1 week, which is 21 to 35 days lasting for 2 to 8 days with moderate flow with a blood loss of about 50 to 80 ml, and it is moderately painful. So there are two types of dysmenorrhea: primary dysmenorrhea and secondary dysmenorrhea. Primary dysmenorrhea means there is no obvious cause of pain. Due to the release of prostaglandins when the uterus contracts to push the blood out causes cramping pain. 90% of people with painful periods have no underlying pathology or disease. Secondly, let us talk about secondary dysmenorrhea. Secondary dysmenorrhea is caused due to some underlying cause. It occurs in about 10% of patients complaining of painful periods. So what are the common causes of dysmenorrhea? Primarily, we see infections in all ages of women. So this is the most common cause of dysmenorrhea. It could be any kind of pelvic infection. Second most common cause is endometriosis. It affects 1 in 10 women. It means that the inner lining of the uterus, which is spread at places other than the uterus, commonly the tube and the ovaries. It disturbs the routine life, leads to infertility, may also cause painful sex, and also pain while passing urine and motion. This is the most commonest cause of secondary dysmenorrhea that we see in clinical practice. Adenomyosis. This is bleeding inside the musculature of the uterus. It usually causes painful periods and also heavy bleeding. Uterine fibroids is another very common cause of dysmenorrhea. Stress. It is also a very well-known reason of chronic pain. IUCDs, that is intrauterine contraceptive device such as copper T, can also cause pain in certain patients who did not have pain before the insertion of the IUCD. In some patients, we see extreme pain with nausea, vomiting, giddiness, bloating sensation, etc. So let's see how do we treat these symptoms. The treatment starts from home remedies like using heat pads, over-the-counter medicine, commonly paracetamol, mefenamic acid, which is commonly called as meftalspaz, dicyclomine, paracetamol, and sometimes painkillers can also be used. Consuming anti-inflammatory food such as ginger, cinnamon, haldi milk, cow milk, banana because it's high in magnesium, high protein foods, and herbal tea also help to relieve pain during periods. So other things that can be done at home are massaging the back or massaging the lower abdomen. Yoga and pelvic stretching exercises done regularly causes decongestion of the pelvis and also helps in relieving pain. While on menses, eat foods that can be digested easily and have high carbohydrates such as sweets, which increase the sugar level and maintain high energy levels. Have medicines only after taking meals and never on an empty stomach. Sleep on the side with both the knees folded, which relieves stress on the back, or lie down with legs elevated at a height as in kept over a pillow, so that the back and the lower body gets relaxed, and these simple remedies and medicines help in relieving pain. If these do not relieve the pain, then please see a gynecologist. When you go to a doctor, they will take your history as to when exactly the pain started. Is it primary or is it secondary? They may do a ultrasound, do a complete blood picture, because if the hemoglobin is very low, that also needs to be addressed. Urine examination to see if there is any infection in the urine, and also they do a ultrasound to rule out any infections or pelvic pathology. Treatment always depends on the age and the severity of the pain. As I explained earlier, painkillers and muscle relaxants definitely help. We also put patients on progesterone and oral contraceptive pills. We have often seen that oral contraceptive pills help in controlling the excess bleeding as well as the excess pain during menses. Increased intake of magnesium helps in reducing the cramps, as it is known to relax the nerves and muscles. Treatment of the underlying cause, if any, as in secondary dysmenorrhea such as infection and endometriosis, also relieves pain. Acupuncture with the help of a trained personnel is also known to give some relief. So if you have unbearable pain during menses, do not neglect it. See a gynecologist to find out the cause of the pain and get yourself treated. Definitely, painful periods are not an accepted part of life if they are not relieved by common home remedies and medications. Thank you.